My name is Jeff Russo. I'm 58 and I love to travel. I'm really looking forward to continuing that passion that I've kind of put aside. The last couple trips I went on, we had to make a whole lot of compromises based on what we thought we were capable of doing. Kind of takes the fun out of being spontaneous. I didn't go swim with the dolphins because I thought it would be too hard to get back up on the boat when they carried you out. I have a dream there's a pilgrimage in Spain from coast to coast. Whoever wants to starts at one coast of Spain and they walk this path all the way to the other coast. And I've always dreamt about doing it. I want to have the dream. I want to have the aspirations. So all those aspirations and dreams that I've put aside, I'm gonna then bring back into my life. You don't realize you're doing this, but you're worried what people see you eat because then they're gonna pass a judgment because you're already so big, that kind of stuff. You don't wanna be the cliche in the room. Another great one is tying your shoes. There were times that I would have to, before I left the house, make sure they were tied in such a way that they wouldn't come undone. And if they did, I couldn't do it. I just couldn't go down and tie my shoes. I had to maybe go into the restroom or something like that so I didn't look too embarrassing just trying to struggle to do a simple task like tie my shoe.
Well, after discussing the operations, Jeff decided to have the duodenal switch, which was an operation where we perform a sleeve gastrectomy as well as an intestinal bypass, so that patient will get restriction with the sleeve gastrectomy, but also some malabsorption, which will enhance his weight loss and his long-term probabilities of success.
I was really comfortable with the doctor, and after meeting him and talking with him for a moment or two, I read a little bit about him. I really didn't go anywhere else.
I can foresee him at a much different place in 6 months or even a year than he is now. I think he's really gonna be a patient that not only does well, but thrives with this weight loss. It has been holding him back, I think.
All the emotions, nervous, I'm excited, and I'm a little anxious, but I'm ready to go. I've done what's necessary to be successful, so I'm ready to go. I started at 380. I'm thinking 250, I'll be transformed.